Hi, I am Robbie Gonzalez Dow, the Executive Director for the California Breastfeeding Coalition, and this is our very first video, CBC Connection. This is our way to connect with the local breastfeeding coalitions and with our partners about breastfeeding issues in California. Today we will start with sharing a couple of announcements, highlighting a few events, provide a legislative update, share some resources, and encourage you to connect with us. Congratulations to Sierra View Medical Center for becoming the 84th baby-friendly hospital in California. On our website, we have a map of all the baby-friendly hospitals throughout California. Just click on any icon to identify the name of the hospital. Hopefully, you have already seen the Save the Date notice for the 7th Annual California Breastfeeding Summit. The planning committee of over 60 volunteers is working hard to plan another dynamic annual summit. Currently, we are seeking proposals for workshops and posters for the 2017 California Breastfeeding Summit. We want to know about projects, evidence-based programs, interventions, and research that address breastfeeding barriers, disparities, and inequities in our communities. So please consider submitting a proposal. Download the instruction sheet here and submit your proposal here. The deadline to submit your proposal is Wednesday, August 31st. This month there were many breastfeeding promotion events and educational events throughout California, and there are three that we want to highlight. The first one is the National Breastfeeding Month Virtual Town Hall meeting hosted by the United States Breastfeeding Committee. It is today from 5 to 6 p.m., so please register here. This is an opportunity for you to share about strategies from any sector of the Surgeon General's call to action to support breastfeeding. At the end of the month, a team of volunteers will review and compile all the comments received into a report. These recommendations will be delivered to the Surgeon General and the Federal Interagency Breastfeeding Work Group. So again, please go to this link and register now and participate this evening. The other event we want to highlight is a webinar sponsored by the National Association of County and City Health Officers. It's called Breastfeeding in the Community: Implementation That Works. This interactive webinar will pinpoint what worked in the field and identify implications for current and future public health breastfeeding initiatives in the community. Go to this link right here to register, and this event is on August 31st from 11 to 12:30. The last event is on that same day, later in the day. The California Department of Public Health is hosting a webinar on the 9 steps to breastfeeding friendly. It's from 1 to 2:30 on August 31st. Presenters will review the guidelines and share how they provide community health centers and outpatient care settings steps to successfully implement practices and policies that protect, promote, and support breastfeeding. And health centers staff will share challenges, successes, and how they address barriers to implementation of the 9 steps. Register here to participate in the webinar. We also want to remind you of one more event. This week starts Black Breastfeeding Week. It's from August 25th to August 31st. Go to the website for more information and actions you can take to celebrate Black Breastfeeding Week. We have one legislative update to tell you about. We are near the end of the legislative session in California, and of the 3 bills that we were following, one is still alive. The number is SB 654. It's sponsored by Senator Jackson. It was formerly SB 1166, and it was revived late in the session. Specifically, SB 654 would allow employees who work for a company with 20 or more within a 75-mile radius to take up to 6 weeks of unpaid job-protected leave to care for a new child. Under current law, only those who work for an employer of 50 or more are eligible for job-protected parental leave under California law. That leaves too many California workers without any job-protected family leave and many new parents struggling with an impossible choice between the well-being of their new child and their family's financial security. We encourage you to download the fact sheet on SB 654. Take a look at the sample letter of support. In the near future, we will be sending out an action alert to notify your assembly member to support the bill when it's on the assembly floor. If you don't know who your legislator is, you can click here. You can put in your address here to find out who your California representatives are. There are several resources that we want to share with you today. They are all under the Coalition Information tab under Coalition Resources. The resources today mostly have to do with data and statistics. So if you click on that link, a page will come up with breastfeeding data and statistics. The first that we want to share is the in-hospital breastfeeding initiation data. The California Department of Public Health's Center for Family Health is pleased to announce the release of the California 2015 in-hospital breastfeeding initiation rates. The CFH monitors the in-hospital infant feeding practices utilizing data obtained during routine newborn screening from genetic diseases. These data are posted on the CDPH breastfeeding statistics website here. You can click on the report that has hospital of occurrence in the breastfeeding rates or hospital of occurrence by race and ethnicity. The other resource is the breastfeeding report card by the Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention have released the 2016 breastfeeding report card. The report card includes 2 groups of indicators which measure types of support in key community settings, as well as the most current data on breastfeeding goals as outlined in the Healthy People 2020. Breastfeeding rates come from the National Immunization Survey, which provides current estimates on vaccination coverage for U.S. children. Since 2001, the NIS has integrated breastfeeding questions which have been used to track breastfeeding in the U.S. And the California rates are right here. California's exclusive breastfeeding at 6 months is above the national average, but we still don't meet the Healthy People 2020 goals. The other 2 resources have to do with workplace lactation accommodation and paid family leave. Under our focus areas on our website, go down to workplace lactation accommodation and paid family leave. Scroll down this page under resources for supporting nursing moms at work. The Center for Law and Social Policy and Breastfeeding have released an updated brief and new infographic on breastfeeding, paid leave, and lactation accommodations to showcase the latest research. The resources highlight the impact of paid family leave policies and workplace accommodations on breastfeeding duration. The policy brief states that the majority of American women lack paid family leave and adequate workplace lactation accommodations. To help improve breastfeeding rates, it's time for a national and paid family leave policy and stronger workplace lactation accommodation laws. This infographic is an excellent resource to share with your local coalition, county health department, local partners, county board of supervisors, and your first 5 county commissioners. The last resource that we want to share can certainly help you to improve access to lactation accommodation in your community. Under the focus areas, in the same page of workplace lactation accommodation and paid family leave, under the quick links, there's a workplace lactation accommodation policy template. Breastfeed LA has published a model policy for employers to become more breastfeeding-friendly workplaces. The model policy includes a very clear outline of the legal support for accommodating employees. Recently, we added our Facebook and Twitter feeds on the front of our website so that anybody could access the information and news. We encourage you to like us on Facebook and Twitter. Social media is a great vehicle for getting up-to-date information at a minute's notice. This is where we will add new news and research immediately. So check out our Facebook and Twitter feeds. This concludes our August 2016 CBC Connection. Let us know what you think about this new format. Send us any comments in the links provided in the email, and share any information with us that you want shared across the state. Thank you so much.